It's like another midnight episode of me talking in front of the camera. But this time it's something very important. I have been in this field of radiation oncology for the past 4 months, being in the first year resident. Like joining here, I didn't know what to do about this branch. I didn't know what was all about, what was the work. I just knew like a few things. But coming to this branch, how I feel right now, what work I do, everything I will discuss in this branch. So if you are giving NEET 2026 INI November, or if you are participating in mock counseling of INI May, so you can consider this branch if you want to. So the first 4 months were like pretty hectic. The time went by like nothing, and I didn't have that much of things to recollect. There were so many things that was happening, but like I have divided this video in 4 5 parts, starting from why I joined, how I am doing right now, how my days look like, something like this. So first of all, like I have made the notes, you can see everything, and I will say that in that manner only. So first of all, why I joined this branch. Uh, to be very honest, it was a decision entirely made out of the fact that let's take the risk, let's bet on myself, because as long as I am alive, I have this motto, I will take a bet on myself. Anyway, it is a win-win condition because I got a GMC in West Bengal. It has the high-tech machines also, and it is a prestigious college. So I am getting the degree, I am getting a good college tag, and then also I am getting the stipend from the West Bengal government standard PG first year stipend only. Also, someone very close of mine said, I cannot prepare more, I cannot waste time more because I was exhausted at that point. And also, I'm not but talented, neither I am so hardworking, or neither I have that kind of patience to do everything again. And that led to like a sudden conclusion that let's take this branch and see whatever I can do from this. And whatever I will say here, it's just my honest take. No sugarcoating is there, how I feel, because there are so many things you will find in this video. I didn't feel radiation oncology in my first, second, or third round All India counseling, neither in the state counseling. But in the state stray round, somewhere I thought, let's give radiation oncology and let's see. So I given the choice of radiation oncology, and somehow by luck or by destiny or by God's grace, I got radiation oncology. And at that moment, I had no clue about the branch, how the work life was, how after like 3 years I'm gonna do what or anything like that. So on 25th of February, 24th, if I am not wrong, 24th or 20th, the result of West Bengal stray round came, and there was just a single day, like that day and a day after was the day for admission. So by doing that papers that day and completing every paperwork, I came day after the result came, and I joined radiation oncology in the college. Interesting thing was I didn't see any kind of video, I didn't see any review, any day in my life, nothing from radiation oncology. It was just a spontaneous decision, ki let's take it and whatever will happen, will happen. So I came back. I started searching about radiation oncology, what to do there. There were so many negative videos on YouTube. There are so many reviews that were totally biased against radiation oncology on Reddit. So if you want to consider about this branch, you just stay away from this. Like because there are two, three things. That is why people are saying. First being that INI doesn't allow MD radiation oncology or radiotherapy people to sit for INISS for medical oncology, but NEET does allow. Every year there is an ongoing case if like people from our branch, MD radiation oncology, are allowed it to sit for medical oncology or not. And this is a like ever going court case. So leave it. First of all, leave that from your mind. There is a common myth or common saying that if you want to take a branch, you should know your why you are taking this branch. If you are at my stage, like someone who has just completed his internship on 2024 and then gave his NEET PG on 2025 and who was desperate to take anything, but he has a nag to work for the cancer at some point of his career. You can consider this. So if I start from very beginning, in my internship year, I got very much interested in orthopedics, and then I got interested in radiology. And somehow I had a plan in the back of my mind that at any point of my time in the career, I will work for cancer. And let me tell you something. This came from two, three patients I was dressing, and I was like, as an intern, I was taking care of. So we used to have one radiation oncologist doctor who used to give chemotherapy to the patient who used to get admitted in our medicine ward. And I was someone who eventually get to like take care of these patients. And I'm so blessed, like that was kind of blessing to me because I have seen metastatic CA breast, like how to manage those patients, and then the dressing part of some patients who has recurrence. There are some lymphedema and everything like that. So that kind of thing, like with the interactions with patients, I somehow grew interested in cancer, and it was my end goal. But somehow it started in the beginning only. Also, for that I am grateful. So as I started this part, like whys are very important. So it was like not my first choice, not my second choice, but as I had a longer vision to work with radiation oncology, and it was like 10 to 12% of my mind was saying, "Okay, just go with it." I took it. But let me tell you, if you don't have any interest in this branch, just don't take it because it will be very overwhelming to you. And if you don't love anything, it will become burden at some point of time. So think before taking the leap. So now, as I am here, being not the first or second choice, or not even like something in third or fourth, but I had an interest in cancer. Let me tell you something. Because I had interest in cancer in the first place, now it doesn't feel like a burden. It doesn't feel so overwhelming. And every day when I see patients in the OPD, every day when I treat them in chemotherapy or in the IPD, uh, it feels really kind of joy to me. Treating them, staying with them, talking with them. This is kind of a feeling that only doctors can like feel or doctors can understand. So that is why it was a good thing, and I have never felt any burden till now. Also, there is one thing that is flexibility. Why I took a branch that is not in my first three or first four choices, because I know that I am very flexible, and I know that even if you throw me at any kind of place or any kind of situation, I will come back stronger. So that is why if you are not flexible enough in this Indian education system, it will be very hard for you. You will lose your peak years grinding for entrance exams. So be flexible sometimes. I'm not telling you sacrifice your dreams, but sometimes being flexible will give you edge over everything. So now comes the fourth point. What was my initial plan and how it is going great for me right now? As I told, orthopedics was some kind of first love for me during internship. It was because of the patient care I did, and it was because of my senior who was very empathetic, who was somewhat like elder brother to me. That is why I fall in love in orthopedics, and then on I fall in love in radiology. But let me frame it like this way. I'm an introvert and I am an occasional introvert, but now I am experimenting on myself, like how extrovert I can be. I thought no patient interaction is the best patient interaction. That is why I kept radiology in the first position. And I had a vision of doing intervention radiology because I am very much interested in machines, imaging, and doing crazy stuff like intervention radiologists do. I used to watch the videos like day in, day out during my preparation. It's still my one of my favorite thing. If I ever get any chance, radiology is something that if I ever get a chance to become a doctor, like from the very beginning to the very end, I will choose intervention radiology because there is some kind of form factor that really attracts me in that branch only, and that's it, nothing else. And then the second option was orthopedics. As I told before, it was because of the environment, it was because of the mentor, my immediate senior, who was like a elder brother to me, and how he used to take care of the patient, how kind he was to me, to the patients, everyone. So that is why orthopedics was there, and orthopedics is some kind of a branch an adrenaline junkie will love. The trauma cases are very nice. The patient like OP care is top notch. But then when I completed my internship and then I went to see some doctors and see some OTs outside the hospital, outside the medical college, it was so disappointing for me because there were so many malpractices going around with the orthopedics. I know I will get hatred for this, but that is the truth with orthopedics and surgical branches that there are so many malpractices are going on nowadays. So these were the two options for me, and like this was the two poles. One is no patient interaction, and one is orthopedics being adrenaline junkie. And now, when I took radiation oncology, I had no prior knowledge about this branch because it's not something you learn about in your internship or neither you in your housemanship. So first day when I was asked by my HOD why I took this branch, I just said because I wanted to work with cancer patients, and the only thing she said afterwards was be compassionate, have empathy and patience with the patient. Don't shout at them, neither to the patient relatives. These are not an ordinary patient, neither the patient relatives are. They are suffering from something that is very long time and they know the eventual outcome also. 4 months has passed, day in and day out, doing the OPDs, interacting with the patient and the patient relative. I realized how correct my HOD was and how the statement still echoes in my ear. Now the patient interaction part. I was wrong. I was wrong in many sense that I don't like patient interaction. Now I can say I truly and humbly that I love patient interaction. I love to listen to their stories. I love to listen to their caregivers, how their life has been changed after suffering from this. And sometimes I try to comfort them with words, and most of the times with medication. I have seen death. I have seen death of a female a decade younger than me. Sudden death of a 56-year-old male. Sudden death of a 32-year-old male. Very little kids were there. I have faced their closed ones, but I have never failed of leaving this branch, but have trained myself not to be emotionless. Because when you see death so closely and so frequently, you tend to become emotionless. You tend to become very stone cold. But this was my thinking, this was my way of thinking that whatever I will become in my life, I never want to become a stone cold person about a death. So that's me. You can have so many opinions about that, but that's me. I have had breakdowns. I have managed them well. I have had severe breakdowns, and thanks to Almighty, I have great circle around me. And if you're watching this, I know you will realize like this part is for you only. Now the main part, why I am making this video, how a day or my life as a first year resident of radiation oncology looks like. So basically, there are 6 days of working, and Sunday is rotational, 24 hours on call. So in my unit, we have three OPD days, three chemotherapy days. Out of the three OPD days, two is normal OPD and one is palliative care OPD. So basically, what as a first year resident we do, we basically see new cases referred from multiple specialties to our clinic, and we see the patients, we evaluate them, we examine them, give test and write prescription, and then we get it checked by our immediate seniors. And then we have to move to our professors and we have to present the cases. After like thorough inspection of the prescription, if there is something to be added, something to be removed, everything is done. This stands for the OPD patients. Sometimes we admit the patients from OPD only, sometimes from chemotherapy unit. Now comes the palliative OPD. Palliative OPD is basically to help those patients who are suffering from pain. And if you have watched the peak, there is a very specific line or very specific moment where a cancer patient was given a higher dose of morphine because she was having excruciating pain. And there, the doctor, treating doctor said sometimes the death or a swift death is far more beneficial for a cancer patient who has been suffering for so long. Palliative in palliative care, we basically give transdermal patches of analgesics and we give opioids to reduce the pain because the pain is excruciating and patients we can't prolong life so long. Sometimes we have to just give the symptomatic management only to the cancer patient. There are some specific guidelines which you can see in the screen right now. This is the guideline for the pain scale, and that is how you treat those patients. The other 3 days are basically for chemotherapy. This is the part where things become serious for first year resident. Chemotherapy drugs are very toxic in every sense. They are doing their best to cure cancer, but it comes with cost. I don't want to sound very like non-professional, but they do collateral damages also. But that is not a good word. Just take it as it is. If you know about like the side effect of chemotherapy drugs, you know what I am saying. And that is only the bookish knowledge. Like things go haywire while giving chemotherapy. Patients literally lost their veins. The veins are collapsed, and that is where you have to find veins. You have to do the cannulation properly, and while giving the drugs, you have to monitor if there is any kind of adverse reaction is happening, and you have to manage accordingly. Like any other branches, we have 2 days of extracurricular activities, one day being the journal club and seminar, and the other day being the multidisciplinary tumor board, where every other specialty come to our hospital. We have a dedicated cancer hospital. Like we have a discussion around a few particular patients, like what should be the future plan for treatment of those patients and what can be done to cure or give a better life to the patients. Now the timing. Most of the days, the timing starts at 9 or 9:30 in the morning and ends by 6 minimum. Sometimes it goes 7 also because of the journal club, seminar, and everything. And yeah, sometimes it gets over by 3 or 4, sometimes before that also. But when there is rush in OPD and there is rush in the chemotherapy, it goes really long. Do we get time to eat? Mostly no, because there is no adjacent like place to have rice, to have the roti or something like that. There are places where you can get chai, biscuit, and bread, everything. So we have to like get those things in between shift, and that's it. Like there is no quote unquote timing for going out and to have food. Now, what is the future plan for me? I am very much into machine AI, machine related procedures. So as of now, I am planning to stick with it. But then again, I am a person who don't plan too much for future. There are some personal reason behind it. But if you are really want to pursue like super specialty, or if you want to leave this country for higher studies after in radiation oncology, there are a few options. Now, after doing radiation oncology, MD radiation oncology, what are the career paths you can do? Academic career path, you can join as SR, do 3 years of SRship, then become assistant professor, then become associate, then professor, and then HOD. It's the long process. And if you enjoy teaching, research, clinical trial, publication, it is one of the best pathways for you. Also gives you a secure income. Then you can go for clinical radiation oncology, do the SRC, become consultant, stay in for government setups, or join any kind of private setup. Also, you can do site-specific fellowship like head and neck oncology, neuro-oncology, breast oncology, gyne oncology, pedia oncology. Also, there is proton brachytherapy. One of the most like trending thing MD radiation oncologists do after their MD degree is sit for NEET SS and then doing DM medical oncology. It is one of the highest paying super specialty branches. You can do that. And also there are international paths. FRCR is the USMLA is there, Australia AMC is there. You can work in UAE, you can work in Japan, Singapore, whatever you choose to. But if you are coming in this branch, just make sure you love to do cancer patient care. First 3 or 4 months or even 5 months will feel like you are an intern or house surgeon doing the basic start works, doing basic things. But there are few thrills you will enjoy here. At the end of the day, after 5 or 6 months, you will be posted in the brachytherapy unit, then in the LINAC, and then it will start interesting. But for last 4 months have been being just doing the intern work and sometime label like a houseman's work, because I have experience in housemanship. So it don't feel like a first year PGT. But when brachytherapy duty will start, when the LINAC duty will start, we will start to enjoy everything. So have patience, like the little exposure of this branch during our internship or housemanship. If you are joining this branch, like seeing this video, or if you don't have any clue but you are trying to play a bet on yourself like I had on me, have patience, because first 4 or 5 months will be basic work only. Afterwards, things will turn around. And this is the first 4 months review. I will give when the brachytherapy and LINAC duty starts. I will make another video, and I will try to capture some clips what I do in the brachytherapy and what I do in the LINAC, and I will put it there also. So all the best for your exam. I hope you will get your desired branch, and if you radiation oncology is your desired branch, just join us.